Staff Training Webinar, Ebony Jolly RN, Capella University. Palliative care is an approach to care that enhances comfort and improves the quality of an individual's life while receiving treatment for a life-threatening illness or near the end of life. The organization believes that palliative care should improve the quality of life for patients needing relief from uncomfortable symptoms. The American Academy of Hospice and Palliative Care recommends 8 domains that organizations should focus on to deliver high-quality care. The organization is concerned with delivering high-quality care to patients and families, which currently includes a rural population. Telehealth utilizes technology to improve communication between patients and healthcare providers and access to healthcare services among populations that live in rural areas. This technology aligns with palliative care guidelines and the organization's standards. Telehealth has been shown to improve patient access to healthcare and improve the quality of healthcare in rural settings. Telehealth can reduce burdens associated with traveling long distance to receive care that patients and families experience. Palliative care is best provided in a community setting. When patients have symptoms of discomfort and cannot achieve relief at home, they go to the hospital. In this organization, telehealth will be used to improve care delivery to patients in rural areas and reduce emergency room visits and hospital admissions. More specifically, this organization is concerned with improving symptom management in patients with CHF, COPD, and diabetes with chronic stage 2 and 3 wounds. When using technology to provide care, patient information must be safeguarded. The Health Information Portability and Accountability Act defines appropriate and necessary access to patient health information for healthcare providers. Healthcare providers are responsible for having measures in place that protect patients' health information. Telehealth is becoming popular in healthcare. To ensure patient information is safe when using this technology, healthcare companies have begun implementing a business associate agreement. An agreement signed between the organization and a technology developer, which holds the developer responsible for protecting patient information. A BAA is an added level of protection for the patient and healthcare company. It is important to restrict access to patient health information. To prevent PHI from cyber attacks, data encryption, private clouds, and password protection are recommended. Improving access to care is a quality measure in palliative care and healthcare as a whole. Telehealth improves patient access to care. In this way, patients and families receive support when they need it. Ultimately, timely support positively impacts patient and family satisfaction with the care received. Palliative care is its own discipline. As recommended by the Institute of Medicine, palliative care providers collaborate with healthcare providers from other disciplines. Telehealth improves clinical data collection. Subsequently, telehealth applications facilitate improved documentation and communication of patient needs between providers. To improve the environment, components of the nursing process were used to conceptualize the process. The nursing process utilizes assessment, diagnosis, plan, implement, and evaluation. Assessment involves collecting data within the organization. Data can be subjective, stated from the perspective of the patient, or objective, measurable, and observed. In this case, data to support the implementation of telehealth was gathered from health insurance utilization records. Design involves considering the internal strengths of the organization, external threats, opportunities, weaknesses, and resources that impact improvement. In this case, the organization is a hospice company concerned with the quality of care delivered to patients. The organization has an opportunity to improve its care delivery by incorporating technology that has been proven to be effective in solving the problem of care access in similar settings. In developing the plan, consideration is given to the actions that need to take place before and after implementing the new technology. Prior to selecting the technology, it is important to ensure that the technology aligns with the organizational goals. In this case, telehealth has the potential to improve access to care among palliative care patients that reside in rural areas. Prior to implementing the technology, identifying the learning needs of nurses and teaching them how to use the mobile application is necessary. Implementation is when a plan or tool is put into place. It is recommended that when implementing new tools in practice, the tool be trialed in a smaller segment of the population before launching throughout the organization. The hospice company serves patients in 4 rural areas. Each of these areas is located north, south, east, and west of the major city. The mobile telehealth application will be trialed among patients in the south, which is the smaller of the 4 rural areas. Evaluating the impact of technology on healthcare outcomes supports making informed decisions. It is necessary to determine if a piece of technology has been successful or unsuccessful in meeting the goals of the organization. Often, using the same data that alerted you to an area of improvement is useful in determining the impact of a tool. The use of technology in healthcare increases the risk of exposure of patient information. This risk necessitates that users take purposeful measures to safeguard patient information. Do not share user ID and passwords with anyone. After talking with the patient, log out of the application to prevent unintended access to patient contact or clinical information. When the device is in use, keep it in your possession. An unattended device is unsecure. If a device is lost or stolen, report it immediately so the Information Technology Department can remotely restrict access, remove private files, and assist in locating the device. The goals of palliative care are to manage symptoms and improve the quality of life of patients undergoing treatment or near the end of life. Palliative care has shown to reduce hospitalizations and emergency room visits. Support for the integration of telehealth in this organization was established using internal data. At this organization, patients in rural areas frequently visit the emergency department for symptom management. In the past year, 20% of patients with a diagnosis of CHF, 33% of patients with COPD, and 17% of patients with chronic wounds in the presence of diabetes have received treatment in the emergency room while enrolled on the palliative care program. To evaluate the impact of telehealth in this organization, internal data will be collected. Hospital admissions and ER visits for patients in rural areas will be collected. This data will be compared to data gathered before implementing the telehealth mobile application. The data will be analyzed to draw conclusions on the impact of telehealth in this organization. A reduction in ER visits and hospitalizations is indicative of a positive outcome. Unchanged or increased ER visits and hospitalizations is a negative outcome. The process of implementing and evaluating new technology is synonymous with evidence-based practice. Collecting data to identify areas of improvement and measuring its impact to guide decision-making supports purposeful practice. The analysis of data before and after implementing technology will support final decision on the telehealth mobile application at this organization. The nurses will participate in the initial training, which is the topic of this assignment. Annually, the nurses will take a web-based interactive course and substantiate their knowledge with a competency exam. When the application is updated by the developer, the nurses will participate in training to ensure they are able to continue using it as intended. The nurses will be given a pocket manual on basic troubleshooting tips. The nurses will be given the number to contact tech support during business hours and after hours. The nurses will also receive an email address to report non-urgent issues. This palliative care organization is concerned with improving rural patients' access to clinical support after hours for symptom management. Telehealth is recommended technology to improve patients' access to health care in rural settings. This organization will utilize telehealth to attain its goal. When implementing new technology, employees must be trained. Training should allow the users to practice with the technology as they would in real life. This teaching plan will include an overview of the telehealth technology and its usefulness to this environment, the patients, and nurses. The nurses will be given an opportunity to practice using the telehealth with one another in clinical scenarios. Nurses will be informed of how to access tech support and what the ongoing training will look like. This plan will effectively prepare nurses to utilize the telehealth application.